My name's Maureen MacDonald, and like Bill was saying, I work at the Ottawa Integrative Cancer Centre. I've been there since it opened in November of 2011. There's currently 3 naturopathic doctors practicing there now, myself, Lisa Kirshner, and Dougal Seeley. I'm looking forward to telling you guys about how complementary medicine, or what complementary and integrative oncology really means, a little bit more about the services that are offered at the OICC and how we can help you, and particularly using naturopathic medicine in combination with what you're doing with conventional medicine for your overall health benefit. So a few terms to keep in mind are what CAM therapies are, because you may hear on the radio about different CAM practitioners and how they differ from alternative care and what integrative medicine is. So CAM encompasses both complementary and alternative medicine. Alternative just simply means instead of, or oppose, or in opposition to. Where complementary is different is that it's referring to in addition to what people are already doing with conventional medicine, and integrating the two for integrative care. The philosophy of integrative oncology is to treat the whole person. So not just looking at the disease that a person has, but what has brought them to that point. So looking at lifestyle factors, looking at stress management contributions, their work environment, the habits that an individual has, as well as looking at genetic predisposition. One of the goals of integrative oncology is to strengthen the whole body while weakening the terrain that supports the cancer. This can be done through different types of antioxidant supplementation that's different for everyone, as well as just focusing on lifestyle to support the entire body. We're really looking forward to developing patient-focused care where the individual is the most important thing to us, where each person is looked at on their own and not just as a conglomerate of a particular type of disease. There are many different components of integrative oncology, and these are to be used in combination with conventional medicine. They range from nutrition, a reducing environmental exposure, different types of natural medicines, encouraging people to be active through different types of exercise programs that are fitting for their level of health, and also helping people to get where they want to go. For example, if someone has led a relatively sedentary life, being able to encourage them to start doing something as simple as walking or swimming, to then even starting to go for little, what I call woggles, which are my combination of walking and jogging. It's much easier on your knees. And then we can look at just building from where a person is at. There's another component of the center which I particularly like, and I'm looking forward to getting to know the practitioners a lot better who are dealing with people who need family therapy care, as well as different aspects of psychiatric assessment. There's 2 ladies at the clinic right now who are both medical doctors, and their care focus is on spiritual well-being and the emotional well-being of an individual. And we're really encouraging people to try to connect with their bodies and to be able to get to know not only themselves where they're at now, but where they want to go in the future with their health. The OICC is unique, and it's part of a new model of cancer care that's developing in Ottawa. The MapleSoft Center, how many of you guys have heard of the MapleSoft Center? Wow, this is great. How many everyone's been down there? Good. Well, I think it's a beautiful facility, and I think it's got such wonderful potential to help people in the area. And the OICC is involved at the MapleSoft Center with the Integral Healing Program. And the purpose of the Integral Healing Program is to help people to get a better idea of nutrition that's important for helping with supportive oncology, psychological care needs, recognizing them and learning where they can get appropriate help, and looking at as well as helping people to plan strategies to help carry them into the future. And also we have the Wellness Beyond Cancer through the Ottawa Regional Cancer Centre. Yeah. So who we are at the OICC. The OICC is a branch of the Canadian College of Naturopathic Medicine. That's the school, again, where I went to after my undergraduate degree. It's a multidisciplinary clinic that's focusing on the whole person. One thing that makes the OICC unique is its commitment to research of nutritional health products in their relation to showing their benefit towards helping people with cancer. I think this is great because in a lot of naturopathic doctors, one of our frustrations is that we have many tools at our disposal, but to know exactly how they're going to help people with cancer is going to be very beneficial in the future. And some of the research projects that they're looking at now are studying melatonin in relation to different types of cancers, curcumin, and showing how they work, at what dosages are important, and what the long-term effects are with using these natural health products. The OICC is a non-for-profit group, just like the Canadian College of Naturopathic Medicine, and there is the potential for subsidized care. It's not quite, the program isn't quite going as fully as it will be in the future, but it is available to people as if once they meet the criteria for subsidized care. And we're really looking forward to providing educational resources for the community and for training people. We have a lot of preceptors that come through, and preceptors are students as well as fellow naturopathic doctors who are interested in learning about complementary oncology. My role, one of my key roles right now at the OICC is running the IV suite. So I teach, or I will be teaching as more people come through, how to do proper insertions of IVs, how to monitor people while they're using IV therapy, as well as different options for IV therapy. The OICC is a pay-for-service facility. Naturopathic medicine is covered underneath most employer insurance coverages as part of the paramedical care section. We do have some OHIP coverage through the family therapist as well as the psychiatrist, and again, subsidized care is available. One of the big reasons why I decided to get involved with the OICC was the vision of the center itself, where they wanted to create a sustainable center that was dedicated to providing both research as well as preventative care strategies for people. The measures of success would be through the effectiveness of the integrative care for people with cancer that improves both the quality and the quantity of life. I've had the pleasure of being able to have met some people who have extended their life expectancy by up to 2 years so far, and to me that was very exciting, and I feel very fortunate to have met those individuals. We're going to be conducting high quality research to test the benefits of the integrative oncology products that we're going to be using. Because it's good to be tracking, because people will always say, you know, I went to see a complementary therapist, but this way we're going to be able to gauge success, which I think is really important. This little circle shows us about the different aspects of whole person care. So we have both the mind and spirit, but also looking at where other factors fit in, including diet, natural health products, physical care and exercise, biorhythms, which I will discuss a little bit more later on, and the idea of green living. And green living extends beyond simply the diet, but also looks at what our environment is like both at home as well as what we're exposing ourselves to on a daily basis. To give you guys a little bit more of an example of who is a part of our healthcare team, we have the 3 naturopathic doctors, myself, Dougal Seeley, and Lisa Kirshner. one family therapist who is a medical doctor, a psychiatrist, our physiotherapist who has specialized in oncology in hospital settings for the last number of years, and now he's decided to work at the OICC. We have an acupuncturist, 2 massage therapists, and 1 nutritionist. This team is going to grow over time as the center grows. Right now, if anyone has gotten to go in, we're at the top level of the facility, and it's going to be a little tight for space with all the people that are involved. But the plan is to expand the center into the basement of the facility where we'll be able to accommodate not only the researchers, but a few more practitioners as well. Now, a quick view at prostate cancer and naturopathic medicine. So the training that licensed NDs have is quite extensive. We're trained in both conventional medical sciences with pathology, physical medical education, differential diagnosis, as well as pharmacology. We do get training in Asian medicine, both with acupuncture and botanical therapies, traditional botanical therapy, nutritional therapies, basic psychological counseling. And I really wanted to stress basic because the skill of the average naturopathic doctor compared to that of a psychiatrist or a family therapist, our job is to recognize when people need to be referred to their medical doctor if they need pharmacological support beyond that which herbs or other nutraceuticals can provide, or if they would receive benefit greater than what I could provide. I always refer. I have an additional 4 years of training with 2 past licensing exams, as well as Ontario board exams. Ontario naturopathic doctors differ very greatly than Quebec naturopathic doctors. In Quebec, unfortunately, it's a bit of a wild west for regulating natural therapies. In Quebec, they say no. However, there are a lot of people who will use the letters little n, little d, but that doesn't qualify the type of training that they have. In Ontario, it is governed, and we all have to carry licensing with continuing education requirements each year. People who carry IV licenses are expected to do a little bit more continuing education, both in emergency care as well as the different treatment options that are available to people. So how can naturopathic medicine help you? I wanted to take a few moments to go through some of the therapeutic options for people through naturopathic medicine. And to keep in mind, we have to set realistic goals in incorporating complementary therapies with conventional medicine. There's 3 key areas where we're going to focus, including lifestyle modification, for example, how to eat, how to be active, different strategies for handling stress, and really encouraging sleep. Sleep is so important, but particularly the pattern of sleep. For example, if people are able to fall asleep, but then they wake up throughout the night, they're not getting restful sleep and their body's not able to rejuvenate like it needs to be able to. And this will then trickle down the line through stress management as well as through general health. Naturopathic doctors also want to look at enhancing the internal environment, looking at how things are oxidized within the system, looking at the balanced immune system, inflammation within the system, as well as different growth signals such as human growth hormone. We also want to enhance the external environment. And this is again where diet and supplementation come into play, exercise plans, but this is also where looking at what's going on at home, like what types of chemicals are people being exposed to on a daily basis? What are they using on their skin? What types of shampoos are they using? What other types of personal health care products are they using? And that's where NDs can really be very helpful, is providing you with realistic strategies on how to mitigate the effects of chemicals in our external environment, but also helping to promote health so that your liver and your kidneys will be able to metabolize and excrete as best that they possibly can. Different goals of naturopathic oncology include decreasing the side effects of conventional cancer treatments, improving the quality of life. And this is really important. I've seen a lot of people who have started chemotherapy and all of a sudden they're feeling very sick. And this is where NDs can really play a role with providing you with herbal options that aren't going to interfere with the chemotherapy, because it's very important that it stay in your body as long as it needs to, or being able to use acupuncture to help to mitigate those effects. With people who are undergoing radiation, naturopathic medicine and different types of with different types of herbs can help to heal the skin faster and provide protection and pain relief. But again, would be used strategically so that they wouldn't be on the skin before people go in for their therapy. We want to maintain treatment schedules because, again, it's very important that people maintain their treatment schedules and get everything on time as much as possible. We want to support healing processes after surgery. Vitamin C is tremendously beneficial after surgery, both oral as well as through IV, because it helps with the regeneration of tissues, and we can help to get people going again after their surgery a little bit quicker. Minimizing cancer-related disease processes. For example, when the immune system is low and when your white blood cells are low, people become more susceptible to colds and flus. There's different types of herbs as well as other health strategies through homeopathics and acupuncture that can help to modulate someone's immune system so that they're less susceptible to these adverse events. And prevention of reoccurrence, and that's where healthy lifestyle development comes into play, as well as key supplementation that is different for everyone. But there are many different types of supplements, from curcumin to melatonin, that really help to decrease the spread of cancers throughout the body. Minimizing the effects of chemotherapy and radiation, we talked just a little tiny bit about. But naturopaths, we really want to help people to reduce the chances of weight loss through healthy food. One of the scariest things that I've seen is people coming in with the can of Ensure, because if you read the back, all it is modified corn syrup. My sister is a nutritionist in northern New Brunswick, and I found it humorous one day that I was down with her, and she and another colleague were deciding how much of a Nestle supplement to be giving to a pediatric patient. And I just giggled because I'm like, they're deciding how much corn to give to a new baby. That poor thing's it's going to take it a little while to get better, but using high quality supplements that provide your body with nourishment is very important versus things that are versus food items that are higher in the inflammatory types of foods. Combating fatigue has been a common concern that I've seen people expressing. This includes not only sleep disturbances, but just general fatigue overall. This can encompass both anemias as well as adrenal fatigue. Adrenal fatigue comes into play when the body has been under a lot of stress for a long period of time, and we will have to look at how to nourish your body to help to rebuild it. Different types of neurological dysfunctions, including neuropathies of the hands and feet, to be mitigated with naturopathic medicine, including both vitamins and minerals, but also different types of herbal strategies. Hormonal dysfunction is really important. With the different types of androgen therapies that many men with prostate cancer are using, hot flashes are a big side effect. Two key things that can be used to mitigate hot flashes include acupuncture as well as herbal therapies. And the herbal therapies have to be chosen very strategically because you don't want to interfere with the therapeutic effect that the androgen therapy is targeting, but you want to help people with the hot flashes they're experiencing. Different tests that naturopathic doctors use to help to follow patients include the regular blood work that's being done through your conventional doctor, looking at inflammatory status in the body through CRP, as well as through ESR markers or erythrocyte sedimentation rates, assessing stress levels in the body by looking at cortisol levels, and this is most effectively done through saliva versus blood testing. Blood gives you a moment in time, whereas saliva will give you a nice track. So you're able to get more information with one test through saliva than with blood. Blood sugar levels are very important as markers of treatment, but also of future health. We want to look at both fasting blood glucose as well as your hemoglobin A1C. Your hemoglobin A1C gives us a 3-month marker of what's been going on in your body with how well it's maintaining blood sugar. And the reason we want to look at blood sugar levels is because high blood glucose increases inflammation in the body. And inflammation over the long term and at high levels causes a cascade that promotes cancer cell development. Taking a look at immune status is very important. Again, going back to wanting to modulate the immune system versus suppress it, or to enhance it beyond a point where it's reacting to foreign invaders. So we want to, by modulation, I'm referring to not increasing the immune system, but keeping it at a nice level so that people, when they are exposed to a foreign agent, they are able to fight against it. But when they are not exposed to a foreign agent, they're not going to be exerting an immune response. And I'm sure you guys have all heard about vitamin D and how important it is to your overall health status. Vitamin D is actually a steroid hormone, and it's very important in helping to prevent cancers as well as in the treatment of cancers. One of the things that we always do is look at someone's vitamin D status. And by looking at where they fit in the range of normal or beneath normal is very important. You want to make sure that your blood level is around 115 to 125. If it's beneath this, then looking at supplementation is going to be very important. But you don't want to be doing high doses for a long period of time. That's why you want to get a baseline, and if you need vitamin D support, take your vitamin D support, but then you want to be retested to make sure that you're not going to be then entering into toxic levels of vitamin D. Post-treatment, some of the things that we're looking for helping people with include detoxification, helping to promote recovery, and helping to promote prevention of further cancers later on down the road. Natural healthcare products are very much in the media lately, but natural healthcare products for people with cancer work on many different levels. They help to destroy cancer cells. They can support and modulate the immune system. They contain a variety of chemicals that work in a synergistic fashion. One particular example of this is lycopene. And lycopene is very important for men's health. And you'll see, anytime you go into a health food store, you'll see little bottles of lycopene. But interestingly enough, the research wasn't done on lycopene supplements alone. It was done on actual tomato sauce. And the benefit is in the synergistic effects of the tomato sauce with the lycopene already in it, and not in the lycopene supplement on its own. And the dose for a healthy dose of lycopene every day is just simply 2 tablespoons of tomato paste. So making sure that you're getting tomatoes in your diet is much more valuable than going out and buying a bottle of lycopene. So what else we can use natural health products for include reducing the chances of developing resistance to chemotherapies. Some different types of chemotherapies work very well in conjunction with vitamin C. And that's where discussing with your naturopathic doctor which therapies are going to provide you with the most benefit is very important. Also, we want to look at decreasing the toxicity of the different types of treatments that people are undergoing. And this can be done through supporting the liver with antioxidants, but not promoting extra detoxification effects that are naturally occurring. And that's one of the reasons why many people are told not to be eating grapefruit, before their treatments, because grapefruit enhances an enzyme in the liver that will remove medications out of the body. And we want to keep those medications in the body, and that's why they tell you don't eat grapefruit. We want to improve the quality of life and survival, and that can be both through stress management tools as well as supporting the key organ systems of the body and using natural health products that are, again, going to complement what you're already doing. One of the big things to keep in mind is that just because it's natural doesn't mean that it's safe, and that there can be many contraindications to taking different types of products. And that there is a potential for interaction with chemotherapy and radiation, as well as an impact on your blood levels with respect to coagulation. Adverse effects are possible, and again, that's why it's important to talk to someone who's properly trained and is taking a look at your health history. So different types of natural health products that you may want to ask your naturopathic doctor or your medical doctor about include melatonin, but this is melatonin at a much higher dose. The purpose of the melatonin is to help decrease the metastasis of cancer, as in particular, it has great evidence supportive of prostate cancer. Curcumin is another powerful antioxidant that's not only protective of the liver, but again, it helps to decrease the spread of cancer cells. DIM and calcium D-glucarate are examples of supplements that are help to detoxify the liver, in particularly removing excess estrogens. Omega-3s, who's on an omega-3 here? Good job. Omega-3s are very important. Omega-3s have an anti-inflammatory aspect in the body. They help to maintain adequate levels of coagulation. It is a speculative risk of thinning the blood with omega-3s. It hasn't been shown that an omega-3 supplement will actually interfere with blood thinning agents or enhance the effect of blood thinning agents. But again, you want to be realistic about the amounts of omega-3s that people are supplementing with, and that more isn't necessarily needed. I've seen some people who will take up to 3 grams of EPA, and EPA is one element of the omega-3 supplement. But most people will take total number of omega-3 of up to 3 grams. There's 2 key components in omega-3, that being EPA and DHA. EPA provides the anti-inflammatory aspect, and DHA is more supportive of neurological function. But it's nifty because your body can convert EPA to DHA, so it's really the EPA that we're looking for. But each individual is different, because for pain management, you would use a higher level of EPA than you would necessarily recommend for someone who's looking at long-term management of cancer. Different vitamin and mineral supplements are very important. Particularly for men's health, selenium and zinc are showing great promise as being effective in the management of prostate cancer. Vitamin C, both orally as well as IV, are really great supplements to look at. Vitamin C orally can only be absorbed to an individual maximum before it causes a case of osmotic diarrhea. If you take too much vitamin C orally, you'll get a bout of diarrhea and then it's over. But we can really increase the amount of vitamin C that someone's getting by using it IV. And the nice thing about vitamin C IV is that it helps to kill cancer cells, because cancer cells don't have the enzyme catalase, and when vitamin C is put into the body in high doses, it's converted to hydrogen peroxide. The hydrogen peroxide is taken up by the cells, and regular cells can break it down and use it because they have catalase, but cancer cells don't. So using vitamin C therapy both pre and during and post-treatment at appropriate times and an appropriate level can have a lot of benefits for someone. Probiotics are also a wonderful way of helping to promote health. 75% of your immune system starts in your gut. And that's why probiotics have been touted and are receiving so much great publicity. But again, it's the amount and the strain. There are different strains that need to be used at different times. For example, Saccharomyces is great before people go into the hospital because it's proven to help against C. difficile. Whereas when you're looking at establishing a healthy gut flora, acidophilus at over 2 billion per day is a great way to help to start establishing healthy guts. I have personally found that all probiotics on the market are not created equal, and one that contains 6 billion may actually be a better brand than one that says it contains 50 billion. And it's been really good to see that even though they say that they contain all the same, people are not getting the same results. So it's good to talk to someone who has had a lot of experience with different types of supplements so that you know the one that you're investing your money in is going to be good for your gut. Helixor. Has anyone heard of mistletoe or Helixor subcutaneous for helping with cancer? So Helixor is it's a brand of subcutaneous mistletoe, and it's not to be taken orally. And what it does is it helps to enhance cytokines in the body, which will then help to fight against cancer. It's injected into the abdomen on a schedule. And if Helixor is a treatment that is being recommended for you, what NDs will do, or what you do to monitor its effectiveness, is you look at how white blood cells are changing in an individual, because we want to see them rise in the neutrophils in particular. But Helixor is great, and it's used as a first-line therapy for cancer in Europe. Now, this is a nice graph because it really shows over the long term how orthomolecular nutrition, or vitamins and minerals, can improve survival rates. And I want you guys to remember that every supplement is not appropriate for everyone. I have seen some people who they get very overwhelmed by all the different research that's out there and all the different promotion of different natural health products. And as a result, they come in with a huge basket of supplements that they're taking, and a lot of them aren't right for them. And it's important to sort through those vitamins and minerals that they're bringing in to find the ones that are good for them and to help them to be able to make better choices, because it's actually can cause adverse effects, and they may even be contraindicated with the medications they're taking. With respect to prevention and treatment, we need to look at the underlying cause and recognize that cancer may be a manifestation of an underlying disharmony within the system. And that goes back to, again, lifestyle, as well as what we're exposed to, our stress levels, how we're metabolizing our nutrients, our oxidation status. And if we don't deal with the underlying issue, cancers can come back with a greater resilience, where they're harder to treat. But eradication is far from the only answer in terms of treatment and prevention. Self-care is very important, and I think that a group like this is so good for helping people to be able to educate themselves and to empower themselves to make choices that are best for them, best for you guys. We want to engage people so that you're using the appropriate things at the right time, and looking at using both understanding tools that are important for physical, emotional, and spiritual health. I made chicken soup yesterday. Now, and you can enhance the environment, your internal environment, through strategies. And one of these strategies includes detoxification. I think detoxification is a very overused word. However, if I have not come up with a better one yet, but if anyone has any suggestions, I would like that. But what we're using detoxification for is to clean the internal environment and to treat and to prevent disease. We want to prepare the body and the mind for optimal metabolism and function. We want to aid in recuperation time, and it's an easy way for people to be proactive about their own health. We're optimizing the organs of elimination. So we're not necessarily continually stimulating excretion from these organs of stored toxins, but we're optimizing their ability to perform their jobs. And we're preparing the body and the mind to make more changes. Now, what your poo says about you. The bowel is very important. And anytime you go in to visit an ND, they will always ask, how are your bowel movements? Or tell me about your poo. Because your poo, it will tell you if a person is constipated. It will tell you if they have diarrhea. It will tell you if they are absorbing their nutrients efficiently, or if they have more serious things happening within their gut. If there's mucus or blood or stools really, really hard to pass, then that tells us that their intestines are harboring more materials than they really should be, or that their liver may need to be supported through herbs like that have bitter qualities. One of the reasons why people always have a poo after they have a cup of coffee is because of the bitter nature of the coffee. The coffee stimulates gastric juices, which then stimulate the liver to produce bile and the gallbladder to squeeze and excrete the bile from the gallbladder into the intestines, and then you have a poo. Now, but on the bottom side, beneath, type number 4, this is your ideal type of poo, where it's easy to pass and it comes out very smooth and soft. But when we get down into 5, 6, and 7, what we know here is that a person really isn't absorbing their nutrients very well. And up top, they tend towards more constipation or simply dehydration. And drinking water is of such value. A lot of us don't drink enough water, and it's one of the best things that we can do for ourselves by drinking good, clean water. It helps to facilitate not only our bowels to move, but for our cells to function. The key parts of building a solid foundation include diet and nutrition, cautious and judicial use of natural health products, supporting an active lifestyle as well as community involvement, and supporting your psychological and emotional health. And why does nutrition matter? Well, for an ounce of prevention, poor diet is a major contributor to cancer. Cancer is in a lot of cases considered to be a disease that was largely started by lifestyle, through sitting too much, through eating foods that are heavily processed or have high amounts of preservatives in them. 1/3 of all deaths from cancer are related to poor diet and lifestyle. And again, going back to water as it being one of the most neglected nutrients in our diet, but the most vital. Has anyone ever heard of The Omnivore's Dilemma? The book, The Omnivore's Dilemma? Yes, good. It's very interesting. I like the work of Michael Pollan. I think that I enjoy his research and how he's putting together different ideas about what our society thinks about food. And one of the big things whenever looking at healthy diet and lifestyle is people will see, should I be a vegetarian? Should I be a vegan? Should I eat a low carb, high protein diet? What types of diets should people eat? At first, whenever I start working with people, the biggest thing is to really encourage them to simply eat food that hasn't been processed, and that they're preparing and taking part in the activity of preparing food and nutrition for themselves. Vegan diets are something that people who have gone through the Integral Healing Program will hear more about. And the reason why vegan diets are being promoted, particularly for helping people through cancer, is because they're low in saturated fats and high in nutrients of green leafy vegetables, healthy nuts, and low in foods that cause inflammation in the body. Some of the main causes of inflammation in the body, or the main guilty groups, are wheat, and your grains, as well as dairy. And that's why vegan diets, they don't have dairy in them, and the food bases are of your ancient grains such as quinoa, rice, millet, spelt. Those are highly promoted in a vegan diet. But the big thing is to decrease inflammation in the system. Some people may have heard about IgG food sensitivity testing. Has anyone heard about it? So what IgG food sensitivity testing is it's a blood test where we're looking at how foods may cause inflammation in the system. And it's a simple skin prick test that will compare your blood against 96 to 300 different types of food. And when it's looking for an immune response from immunoglobulin G, or your gut-associated immunity, if you get a positive result for a food, that means that the proteins from the foods are getting through your gut and into your bloodstream. They then become the antigen, and your body responds by producing antibodies against that specific antigen. And this tells us that that particular food item is not best for you at this time. And by removing that particular food item, you're removing stress on the body that causes inflammation. With respect to different types of internal rhythms, I would like to focus on the circadian rhythm. So it's a built-in physiological rhythm, and it's tied to how our bodies normally function. Key modulators for circadian rhythm include melatonin and cortisol. When people live a high-stress life, their cortisol levels go up, and then it becomes harder for them to sleep and to relax and to be able to rejuvenate at appropriate times. Melatonin is one of the most powerful antioxidants that is available to us, and it helps us to be able to maintain proper sleep cycles. We want, again, going back to where stress causes internal fluctuations in the body, and going through where it increases cortisol levels. So different ways to help to promote sleep include keeping your bedroom really dark and quiet. One thing that I find as I've moved to a city, I'm originally from PEI, and when it was nighttime, it was dark. But here, when it's nighttime, it's brighter. So I have a little sleep mask now, which I absolutely adore. It's been very helpful in terms of getting a good solid night's sleep and not waking up throughout the night. Exercising daily can help to release energy, but it also helps to promote normal sleep patterns by making sure that people have energy during the daytime, but in the nighttime that they can acquire the rest that they need. Eating protein at dinner is a great way to avoid blood sugar spikes at night that might keep you awake. And some aids that promote sleep that are quite safe include lower doses of melatonin. You want to, when people are starting to use higher doses of melatonin, and by that I'm referring to 20 milligrams per day taken at night, you want to be underneath the care of an appropriate healthcare provider. Skullcap is a very good nervine herb. Tryptophan is a protein that is also very helpful in helping people to sleep. So relaxation as the antidote to anxiety. It's really easy to say, but it's very hard to do. But helping people, but one of the things that the OICC wants to do is to help people to have tools that will help them to be able to meditate, to be able to teach them how to do yoga. I always encourage people to have Epsom salt baths, and when they take their Epsom salt bath, to take the bag and use half of it per bath. And the reason is because you want a super saturated solution with magnesium that is then driven into your muscles and helps you to relax. Whenever you go in and just sprinkle a few salts, you're not going to get the benefits, the relaxing benefits of the Epsom salts, and it's not going to give you as good of muscle relaxation, and your sleep is improved by the more salt that you use. Having a schedule to help you to relax is another key strategy that is often very important, because people lead very busy lives, and unless you're purposefully putting in the time to take care of yourself, to relax and rejuvenate, it just might not happen. And as you're rebuilding your life, your health, you want to be able to be active and to also use that as a tool of relaxation. If you go to the website and put in "sitting is the new smoking," they have some really good statistics as well as information on how much sitting is killing us. And one thing that I have found as I've gone from being a student to, yes, good job. From being a student to working is how much I sit now, and having to have made the change in my routine from coming home from work, but before I go home, to now going to the gym, because otherwise I'm not going to be getting in any activity and I'll be sitting all day. And with sitting all day comes in back pain is a huge issue, because with sitting, your hamstrings get tight and your IT band gets tight. So because those are tight, then you get referred pain up to your lower back. But also, sitting is not good for our cardiovascular systems. Many years, or when our grandparents were growing up, they were out working and doing a lot more physical labor than what we're doing right now. And it's just so important that we make exercise purposeful, or during the daytime, getting up for a few minutes every day, or not a few minutes, every hour, get up and walk around the office where you're working, or get up and walk around your home. And doing something as simple as that can really make a big difference in the long run. And again, going back to exercise, we wanted to keep it mild to moderate and build up the intensity as you're starting out. And that the human body, we were simply meant to move, and that the more that we're in offices or sitting in our homes, the less benefits that we're getting from exercise as well as mild movement. It's a great stress management tool, and it's important to set a goal of do something every day for 30 minutes. The chiropractor who I see, I always hear him telling his other patients that for every decade that you are old, that's how many minutes of exercise you need to do. So a 30-year-old has to make sure that they do 30 minutes of exercise every day. A 40-year-old needs to gauge for 40. I think the cutoff I haven't asked him where the cutoff is for ideal time yet, but next time I see him, I might pick on him about that. So in conclusion, the OICC is here to help you to develop a complementary medicine treatment plan. We want to work with you on the strategies that you're undertaking through conventional medicine. I want to encourage you all to be self-empowered and proactive through lifestyle interventions, including nutritional choices. And that naturopathic medicine has many benefits towards helping mitigate side effects. And our goal is to help you to be able to live the best quality of life and the highest quantity of life that we're all afforded to in this lifetime. And I want to thank you all for having me in here. It's been a pleasure speaking to you. And if you have any questions, please feel free to ask.